Alternative Dig Talk. Real issues, real talk.
Go to the church, though.
Tawali man, what's up?
Man, can you imagine people just dump everywhere? Someone drinks water and throws the bottle wherever.
Come on, Rogers. What else do you expect people to do with an empty bottle?
Simanya now, recorder. Do you know that plastics take at least 450 years to decompose?
What? That's a long time.
Exactly. Because plastics are made out of a lightweight and flexible material that doesn't decompose easily. And plastics everywhere in the environment cause plastic pollution.
What is plastic pollution now?
It is the accumulation of plastic waste in the environment, like bottles, polythene bags, straws. All of these contribute to plastic pollution.
I have been using them without knowing their effect.
Yeah, a lot of people have. Plastics are a danger to the ecosystem, both on land and in water.
So how can we overcome this problem? Is there something we can do?
Oh yes, we can reduce by minimizing the use of plastics, reuse by repurposing them, or recycle by collecting and processing them into new products.
Everyone wants to change the world, but no one wants to change themselves for the world.
How about we change our habits for the world?
And it starts with me and you.
This message is brought to you by Alternative Digitalk. The Alternative Dig Talk. Real issues, real talk.
Welcome aboard. My name is Edgar Mathew Karuhanga. We are into a new month, that is the month of April. It's the first day of April 2025. Many people in the world celebrate this day as a World Fool's Day, but we refuse to say that April 1st is a World Fool's Day. No. It's just the first day of a new month, that is the fourth month of this particular year. We are beginning a new cycle and a new quarter for the year. And of course, here in Uganda, we start off with a new story of Umeme handing over power officially to the government of Uganda. That starts today on the first day of April 2025. We're going to be seeing the company of Uganda, that is Uganda Electricity Generation and Distribution Company Limited. I don't know why it's limited, but it shall be at the helm of power supply and generation in this particular country. We bring you that and much more. I will be telling you what happened as we were handing over this particular, work of Umeme, and of course, what does it mean to Uganda's ecosystem. Remember, you can watch us on our social media platforms. That is at DTalk TV on Facebook, but also on YouTube. We are always here every Monday to Friday. We start at 8 up to 10 a.m. having a conversation with Uganda. My name is Edgar Mathew Karuhanga. This morning, I'm privileged to be having a gentleman called Onyum Charles. We're going to be talking about the statistics and vital statistics in this country. How do we interpret them? And of course, what does that mean to you? We are talking about death. We're talking about birth rate in this country. And we're talking about everything. What does that mean to the planning of this country, but also generally to the future of Uganda? My name is Edgar Mathew Karuhanga. But before I welcome our guest this morning, let me start off with some of the news stories that are continuing to trend in the country. Now, yesterday, Umeme handed over, every work or all things that are pertaining to electricity supply in this country. This comes at a time after the Umeme has been serving Ugandans for the last 20 years, after they signed an agreement in 2005. Now, this gave Umeme the power to be able to supply everything, all electricity to all Ugandans. And they come up with what they called a Yaka meter, a new phenomenon where people just had to pay for Yaka, get unit numbers, and have them input in that particular device. So after 20 years of serving Uganda, the government found it prudent that this time round the government itself monitors and works on everything power. So this is going to be done through a new company that is going to be serving Uganda, that is the Uganda Electricity and Distribution Company Limited. This entity will be the one to manage how power is distributed in this country. Umeme lives through the, in fact, Isobi Tature Patrick, one of the, in fact, the board chair and the board member of Umeme, thanking and commending themselves, first of all, for a job well done. Bitature says that they have been able to, first of all, increase the supply of power in Uganda, thereby increasing resources or money for themselves and, of course, for the country. Bitature also says that they found Umeme at a time where corruption had infested that particular entity. In fact, he remarks and says that corruption was the toppest, or the corruption in Umeme was one of the biggest in the country, bigger than any other agency. So he says from the time they were at the helm of this particular entity, they have been able to fight corruption, especially in Umeme. He also points out that by 2005, the Umeme board was mainly supported by what you may call foreign agents or foreigners, especially foreign experts from various parts of the world. Now, he says at the time that they are leaving, or that he is leaving the leadership of Umeme, he leaves it in safe hands, and he continues to say that this is something that he has been vital in fighting. He has been able to bring in Ugandan experts, Ugandan people to be serving at Umeme. So that is also another win that you can register for them. But also, there's also an issue of the efficiency of government, and especially from Ugandans. Ugandans think that, I think this time round government should do better, especially in ensuring efficiency of the electricity itself, but also the distribution and the work of the electricity companies in this country. So we hope that as government takes the helm of the leadership of distribution and power supply in the country, we hope that this will not be marred with some inefficiencies, as we have seen in the past with some of the government-run entities in that regard. So, as we speak today, it's the government of Uganda that is held responsible. In case you want to find out more about anything power, in case you want to tag, to request for help in any way, you will not be talking to Umeme, but you shall be talking directly to the government of Uganda. You're still watching the Mighty Drive show. We're still starting off with the Mighty Global Updates, where we give you news that is happening in Uganda and, of course, across the country. I'll talk about South Sudan simply. Recently, Dr. Riek Machar, who is the Vice President of South Sudan, wrote a letter to the United Nations, first of all, talking about the interventions that have been done by various people, especially in South Sudan. He says that Yoweri Museveni has been pivotal in bringing about confusion, first of all, in that particular part of the region. So that is something that some people were talking about, highlighting the plight of South Sudan, especially in what is happening there. Remember, Uganda has its troops and forces on ground right there in South Sudan, and we shall be, talking about that much more later. But as we speak right now, the United Nations has already confirmed that it is not okay for the Ugandan government to continue having its troops in that particular part of the region. Remember, Uganda is not only in South Sudan. We are in Congo as we speak. We even had recently intensified battles there. We are in Equatorial Guinea as peacekeepers there. In fact, we are working as hired soldiers, our hired troops, to be working in Equatorial Guinea. We have our soldiers in Somalia on ground. So the question is Uganda starting to work as a militia or a hired mercenary, Uganda People's Defense Forces? Because if we are having various troops in various countries, what does this mean? I remember yesterday we had a request by government to be able, by the Ministry of Defense, to fund the operations in South Sudan. In fact, they requested for over 39.4 billion shillings. That's approximately around $12 million. And that is the money that is needed to make sure we continue with our operations in South Sudan. But many are asking, is this our war to fight? Is this our plight, or is this something that we need to be doing? Maybe we shall be talking about that. As I come to the end of the Mighty Global News Updates, allow me just go through some of the tabloids or some of the news platforms we have in this country to tell you some of the stories that you can find on various platforms. If you are to check the Daily Monitor, what they dubbed the bad paper by the president, there is a story here about Mr. Chari Nekameka, the owner of Nerika Farm. She's showing you how you can, use agriculture to better yourself. Then also how to pick up after dropping out of school. If you have dropped out of school, you can read through, because there are a couple of stories here. But of course the head is Umeme Hands Over Power. Peacefully. It's not something that you often find in this country, and what a kind of unique headline from the Daily Monitor. Then there is also Jinja Masese police station escapees rise to 15. There was an escape from prison recently, and of course this is not the first time we've had various breakouts, especially from Ugandan prisons. You remember in Moroto, the case of Moroto, where more than 50 prisoners were able to escape. I hope we are doing something about this. Then there is also a survey that was done in districts of Budaka, Kibuku, Palis and Butebo, showing out people who dropped out of school prior to their P7. And in this survey, we realized that 11,000 boys drop out of school in those districts before P7. Then, of course, 11,000 girls as well drop out of school, especially in those regions. Remember that many students who start their primary one exams do not get to complete their P7, and this is what they are talking about when we bring you these numbers. Then opposition vows to probe the 463 billion. That is the Umeme buyout. Remember, Umeme requested for $190 million as a buyout, but according to the Auditor General, this money was overly inflated. He says it shouldn't go above $118 million. So who had added in an influx of over $70 million? What does that mean, and who exactly is behind that particular buyout? And of course, what the question is, what is the buyout itself? Are we buying out the assets that belonged to Umeme? Because according to some of the reports that we are getting, Umeme did not even have assets. Umeme was not responsible for the distribution and generation. It was the midway between us, the consumers, and government itself. It was a middleman. So what are we buying out Umeme for? And also, there was in the past when one parliamentary committee requested for the owners of Umeme to come through and talk about some of the challenges here and there. We did not have any person come out officially as the owner of Umeme. So what also does that mean? Who are we paying out for? Is this actually a South African company as we are sat? Does it actually have South African ownership? That is something that we'll be highlighting on. Then also we still highlight Shaka Sali. He's highlighted right here in the Daily Monitor as one of the veteran journalists of this country. I'll just end up with the New Vision that is a government tabloid, and we shall see what do they have in store for us this morning. Remember, I'll be talking about statistics, in fact, vital statistics in this country, and I have a gentleman in studios who will be telling you more about that. But before I even welcome him, the main topical headline in the New Vision is Umeme exit, government cuts power rates. Yes, so there is a plan that if government is actually behind the helm of electricity, it's going to stop being as expensive as it has been in the past. Then in Seoul, South Korea's Constitutional Court will issue its long-awaited ruling on President Yoon Suk-yeol impeachment on Friday. Remember, this president is being impeached from South Korea. You can read about that. Then Ugandan women craving their space in the oil and gas sector. How are they doing that? You can get yourself a copy of the New Vision this morning. Then we also have monkeypox cases that are continuing to soar in the country. We now have more than 4,000, that is 4,800 monkeypox cases. And of course, most of these cases are in districts of Mbarara, Wakiso, and Hoima district. Remember that this condition is highly infectious, and it is spread by sharing different body fuels and of course accessories that we use in our day-to-day lives. Maybe lastly, over 100 left homeless as fire destroys 22 houses in Yumbe districts. These are some of the stories that we seldom listen or hear about in the media today. Those are some of the stories that you can find on the various platforms. That is on our social media platforms. They are there, but you can also check New Vision and Daily Monitor. Grab yourself a copy of your daily newspaper. This morning, I'm privileged to have Charles Okao, Onyum Charles Okao. Okay, we shall be talking. Okay, I think let's just hear in from our guest this morning, who is joining us in studio right here. You're most welcome, sir. Good morning.
Good morning to you.
Yes, sir. Today we are expecting to talk about statistics, vital statistics in this country. What is your comment? What should they expect?
Thank you very much for hosting us here. My name, once again, this morning is Robert Offiti.
Yes, Offiti.
I work with the HEPS Uganda, which we know as Coalition for Health Promotion and Social Development.
Yes, sir.
We are 25 years old. I'm glad you are 5 years soon. And we are in this campaign of statistics. But who are we? We are a health organization. And our role is simply to see to it that as an NGO, nationally registered, we work with stakeholders to see to it that health and socio-economic resources are achieved by Ugandans through partnerships, through research, capacity building and advocacy.
Exactly. We are going to be hearing how you have been doing that. Ladies and gentlemen, let's take a short commercial break. You're still watching Digital TV. My name is Edgar Mathew Karuhanga. When we come back, I'll be starting with Mr. Offiti, and we'll be talking about that and much more. Good morning.
The Alternative Dig Talk. Real issues, real talk.
Hi, Rogers. Can I ask you something?
Shoot.
What does corruption mean?
Well, summarily, corruption is abuse of public power for personal gain or for the benefit of a group to which one owes allegiance. For example, when a public office is abused by an official accepting or soliciting a bribe. By the way, private people can be corrupt too, like bribing police officers to escape fines.
Okay. So exactly how does that concern me?
Well, do you pay taxes?
I guess, yeah. What does that have to do with this?
Everything. Because those taxes you pay are supposed to facilitate services you use, like water, electricity, roads construction, medicines in hospitals, name it.
Okay, that is much bigger than I thought. But it can be stopped, right?
Well, yes, it can, although it may not be as easy as it sounds. And here is the reason why. Corruption roots are grounded in our country's social, political, economic, bureaucratic traditions and policies.
So, what has kept it going this long? I mean, why don't we stop it?
Well, the main reason why it has been here for so long is because institutions are weak, either as a result of poorly defined ethical standards of public service, weak administrative and financial systems, or ineffective watchdog agencies.
What can we do to stop it?
at a national level, we must focus on strengthening the independence and effectiveness of public institutions that fight corruption. At a personal level, we must commit to never giving a bribe.
I promise I'll never give a bribe.
Well, that's a great decision you have made. Me and you now have to spread this message to all our friends. If we all do our part, corruption will be no more.
This message is brought to you by Alternative Digital.
Looking for a pair of shoes? Les Hub Stores has a wide range of selection for unisex footwear. We have the best quality of all brands at pocket-friendly prices, and we make deliveries countrywide. Just place your order or reach us on 0772 08 0090. You can also check up at Les Hub Stores on all our social media platforms. Les Hub, craft your own footprints.
The Alternative Dig Talk. Real issues, real talk. The Alternative Dig Talk. Real issues, real talk.
Welcome back from that break. You're still watching Digitalk TV. My name is Edgar Mathew Karuhanga. If you're just joining us, we are having a conversation about vital statistics in Uganda. These are civil registration and vital statistics of this country. Remember, statistics are very, very pertinent, especially when we are to build a better Uganda, because they shape our decision-making processes. And to have this conversation this morning is the regional manager for HEPS. They will be talking about that organization and what it does. That is Offiti Robert. But before I welcome him, I have Septinde Apollo. You're watching. Thank you so much. You say Uganda yebadde ensi yaba Pharasians, Caucasians, cowboys from Ethiopia, Jukila, and eno yensi ensuubize abayudaaya gye basinga okwetaaga, the holiest Canaan land part of Africa. You're really very passionate about your country. To him, Mr. Norman, thank you for watching. Then Henry Manjeni, Kasule, Ismail, Mukasa, Babi, Brooke Williams, Chikomeko, Mwesige Joram from Kienjojo, Judith Nalukwago, Henry Lwoy, all watching. Thank you so much for tuning in. Allow me welcome the regional coordinator for HEPS Uganda, Mr. Offiti Robert. Good morning and you're welcome once more.
Good morning to you, Matthew. Thank you for hosting us on Digitalk Media, and we are glad to be here.
It's always a privilege to contribute to the conversation. Just tell us more about HEPS. What does HEPS mean? HEPS Uganda, for those who are just hearing it for the first time.
Coalition for Health Promotion and Social Development is the name of the organization.
Yes.
But the acronym is HEPS Uganda. We are located in Nakulabye, Balituma Road, and we are 25 years old. We are a national NGO, and we work with government and other stakeholders to see to it that we ensure access to health and socio-economic resources to all Ugandans through advocacy, research, capacity building, and collaboration.
Wow.
Our goal is to see that every Ugandan is able to achieve or reach socio-economic and health outcomes that they aspire to have.
That's beautiful. And you've been doing this for the last 25 years.
Oh, yes.
How has it been working in such an ecosystem like Uganda?
Uganda has a number of laws as per the constitution, and as an NGO, we work under the law. that governs this country, Uganda. We have the NGO Act,
Yes.
which empowers us to register and operate while honoring all the legal frameworks. And as we work, we have enjoyed working with all government ministries, departments and agencies, local governments, which are districts now, but also we work in coalitions with other health practitioners who have the same mind in terms of accessing universal health care to all Ugandans, and those are other CSOs, CBOs, and individuals. And our funding basically comes from international organizations, philanthropies, but also individuals who feel that we are able to bring services to where they need to be. And by doing so, we've been good in what we do in terms of maternal, child, neonatal health, HIV, in terms of advocating for TB, reproductive health, issues to deal with how to empower the girl child, integrating gender into what we do. But to do that,
Yes.
we do it through research, existing data, and that is why we saw to it that is necessary to strengthen systems upon which government bases to deliver services to Ugandans.
So you're like that bridge that you're doing most of the research, but you're doing it for government, on behalf of government, to make decisions. Is that what you're saying, sir?
We support government.
Okay.
Government is like dad of the family.
Yes.
And so we work in its compound lawfully. And so we use its research and we monitor what it is doing. And in our monitoring, we are able to do surveys, we are able to do studies and assessments and say, hey, look, you said you are going to provide these services in terms of maybe maternal service, but we see that in health facilities, maybe magnesium sulfate is not enough or it is out of stock, and so mothers with preeclampsia, some of them are dying.
Yes.
But what can we do now? So please do A, B, C. So we come up with proposals and put them on table.
Yes.
So it is out of this monitoring that we get data which we report, and when they verify it, they are able to take action. And when we have partners like Global Health Advocacy Incubator, we are working with in CRVS, then they say, please, we are giving you support. Now see how registration is working and how it can inform data for health for better service delivery in the country.
Wow. Yes. I can get you. So you're actually shaping policy in the wide scheme of things, and you're holding government accountable according to what they promised or what they even say themselves, to say that you say this. What is the impact that you have created so far in the last 25 years, if you are to say that this was maybe a blossom for the works that we have done as HEPS Uganda?
At national level, we have been glad to note that we work through collaboration and we contribute to. And so in partnership with other actors, we have able to contribute to improvement in access to health, where we have issues to deal with gaps in service delivery for health. We have been able to contribute to access to HIV services, TB services through our monitoring work. We have programs like community-led monitoring, where the community living with HIV is able to monitor and report whether or not they are getting services. And through that, we identify enablers which help government appreciate what is working, but also disruptors to health service delivery. And so we are happy to contribute to such work, but also in maternal child health, we have been able to contribute to reduced death due to preeclampsia in the country by advocating for increase in availability of reproductive health commodities like magnesium sulfate, which is used to treat mothers who have hypertension during pregnancy. We have been able to contribute to things like information dissemination to communities, where we advocate that people need to know their health rights, and when they are able to do so, they prevent disease instead of going for...
Do you do that through drives, campaigns? How do you do that advocacy itself?
Yes, campaigns are part of them. We have been part of cancer campaigns, TB campaigns, WASH campaigns, water, sanitation and hygiene. We have been part of tetanus campaigns in the country, HIV, AIDS campaigns. But also in communities, we work through district local governments and the Ministry of Health, and then we are able to organize outreaches to extend health services closer to communities that perhaps are far from accessing.
That's where I was even going to come.
Yes, so we work with the district health teams, and we are able to organize community outreaches which are integrated, such that we have a consortium of health services reach out to communities away from the facility, which is static. And so by doing so, we work in collaboration with health facilities, the health workers, the local government staff, such that we know that numbers that are not able to access health services are able to access them, and access them with the quality services and commodities that government provides.
Wow, that's extremely brilliant a job that you are doing, but you're mostly relying on, as you said, donations of funding and grants, things like that. How sustainable is this, especially when we are at a time where most of the NGOs and funding for projects like that is continuing to shrink globally, but also in Uganda here? What is the future for HEPS, especially in financial sustainability for you people as an organization?
As an organization, our board has a strategic plan, and one of the actions and strategies it has is to have investments as an organization. And it is from those investments that cushion such challenges when they come, to ensure that HEPS is able to continue programming, even when we observe the fact that there is shrinking space and also funding stream that leads to decline in funding. So yes, that is happening. It has shaken us, but it is not the first time. We have gone through this before and we have bounced back, just like other strong NGOs and civil society organizations in the country. And we are glad. That's why we are here. We are now here again to continue talking about civil registration and vital statistics.
Thank you, thank you. We are still with Robert Offiti, gentleman from HEPS Uganda. We just wanted to first find out about HEPS. But before I leave you to enter the statistics bit, there is also giving them wisdom or giving people knowledge about these issues. Sometimes one would say it's not enough. Are you doing something? For example, you said you are moving with medical helpers or medical practitioners. Yes. Do they actually treat these people if they phone someone with that condition you mentioned? I don't want to say it because I'll bite my tongue, but that condition, for example, can they treat them? Is there impact that you can say, at least someone will say, because of HEPS, I have a condition directly that has been helped out?
Yes, we have people who have been treated.
Yes, sir.
You see, in Uganda, the responsibility to provide health services is upon government.
Yes.
And they have an array of health facilities and staff who are there, so whom we collaborate with. And so when we advocate for policy, policy guides how things should be done, policy guides how the public should be handled and where they should get resources. For example, a health center 3 at that level, policy says at that facility one should receive immunization, should receive maternal child health services, should receive treatment and all other preventive methods for malaria and other diseases in community. But also that facility should be able to promote preventive measures in community through other structures existing like the LOC system and the VHTs.
Yes.
And all these are establishments that HEPS works with. And we are confident that people have been treated. People have been receiving treatment, but that is not to say that that is the only thing we do. we also contribute to dissemination of information.
Yes.
Just as we are here today to talk about civil registration and vital statistics. So it is important for people, one, to prevent disease,
Yes, sir.
and it is their right to have access to health information, but also have access to health services. So these are some of the things we talk about in communities as we engage and even participate in planning and budgeting processes on behalf of other CSOs, but also in coordination with other stakeholders.
Okay.
And so we are happy that the work we've done has led government to recognize what we do, and even international development partners to trust us with their resources up to now.
Thank you. Thank you so much. I have a copy here of the civil registrations and vital statistics in Uganda. It's actually an information brief. It's more of what you may call notes. He teaches you what is civil registration, the meaning of vital statistics, the purpose, value of these things, the CRVs, enabling policies for you who's just joining. We're going to be highlighting on these. They talk about key CRVs institutions and their responsibilities, the current situation in Uganda, how it stands, the birth notification in health facilities, birth registration, birth certification. Before we even delve into these numbers, I was reading through them last night, but how credible is this data? You know, in this country we have a problem of mistrust, and he who pays the piper determines the tune. So you are interpreting data, but before you even talk about these civil registration and vital statistics, how can I trust the statistics that you are bringing here to this morning?
That is one of the things that HEPS Uganda is good at, ensuring that the data we share with the public is closely scrutinized, vetted, that it comes from credible sources. Your statement is correct, and that is why HEPS has taken time even to come up with such information. And so the source of that information, one of them is the Uganda Bureau of Statistics, which conducted the previous census in 2024. And so we base on that. But also we have data which comes from reports of the National Identification and Registration Authority. We have other sources like the UN. We have others like Ministry of Health, which we read and try to triangulate this data such that when we go out to communicate, we are able to say, according to this source, which is a government agency, and that this government agency did this work and even disseminated it. That's why some of that information sheet does not have a lot of statistics. We are looking at what is credible and that has been authorized for the public to use. And that's how we contribute to policy reviews, to research and improve.
At least you have established credibility. For me, this is something that was pertinent. I fact-checked the president who said that Uganda was a middle-income country by 2022, which was not, and he was using UBOS, but I also understood where he was coming from, and I used other entities like World Bank to juxtapose and say this is the verdict. So if you say that you don't just believe gullibly as UBOS gives you and you just collaborate it with other agencies, then we can establish credibility. So for that person who's listening about civil registration and vital statistics in Uganda, what does this mean and why is it important?
The United Nations defines civil registration and vital statistics as a continuous process which is universal, meaning everyone, everywhere, at any time. And it is continuous, meaning things change. So it is a continuous, universal process by which events pertaining to persons or individuals are registered into a system by recording information about them according to the law established in that country. Now, what do they register under CRVS? They register births of a human being. They register a death of a human being, marriage, and divorce, as well as adoptions. These are regarded as vital events in someone's life.
Exactly.
Birth, death,
And the wedding. Those are the parties that we celebrate in life. Yeah, the three vital
of course,
parties, yes.
one which is normally celebrated is the marriage. Yes.
Yeah.
So the marriage, the divorce as well, which is normally unfortunate,
Yes.
but also adoptions. And so in Uganda,
Yes.
we have a law, a legal framework, which guides how this should be done. But as per the Constitution, the mandate for registration by law is established by the Registration of Persons Act as amended 2024 in Uganda. It is the act that establishes the National Identification and Registrations Authority, which is NIRA.
Yes.
But doesn't work alone. It works with other ministries, departments and agencies, local governments and other actors, including you and me, who is the citizen.
Yes.
Because their services are ours.
Exactly.
So it is our responsibility to go and access these services.
Yes.
And so the discussion today is what it is and why is it important.
Yes.
You see, we have a law in Uganda which says that every citizen shall be registered after birth. And after registration, they have to be accorded a national identification. Now, in Uganda, when you have a national identification, it means you have a national identification number. It is one which will show that you are Ugandan. No one else has it. So I'm coming to the importance of CRVS.
Yes, yes.
Why are births registered? Why are deaths registered? Now, I'll start with births. One, it is proof of legal identity that you are a Ugandan, not a South African. You are born maybe in Bali, and the system should be able to know that Matthew or Robert is born to Mr. So-and-so and Mrs. So-and-so of this place. Okay?
Yes.
And in the National Identification Register, you are accorded a number as a citizen of the country.
Yes.
Now, where does that happen? Births happen in health facilities. Close to 50% of births may happen in health facilities.
Yes.
But other births happen in communities.
Yes, at home.
At home, others now have traditional birth attendants in the villages.
Yes.
But other births happen, for example, in prisons.
Yes.
Now, there are systems under the law that guide that when a birth occurs at a facility, the officer in that facility ought to guide the mother to notify government that Robert Offiti or Matthew has been born today, and this is the name to these parents and all this, such that that person already feeds into the system.
I get you.
As a statistic now. Is he or she female or male?
Yes.
Now, we are going to the bit of statistics. Those other details which are necessary for analysis,
Name
such
of
that
matter, where they come
where
from,
they come,
ID number,
ID
things
number,
like that.
even the date. The date of birth gives you the year, such that you are able to scroll and say, in this year, in this month, these are the people who were born. You get. So that one is a source of this data about the number of Ugandans born where to who. You get.
Yeah.
So, one, it is proof of legal identity that you're Ugandan. And so every parent should do so. It is a responsibility of Ugandans, every parent, to register their child immediately after birth.
Exactly.
Not when you can't avoid it.
Because we realize there are many people who grow even up to like 13 when they don't even have ID. When
This is
the
it.
country does not know them.
They
You
go
know,
to
but
register
they
for
don't know.
PLOE, and now they are running up and down.
Looking for the birth certificate. Yeah,
well,
you know. Yes,
yes,
exactly.
can we, okay, if you don't have a birth certificate, okay, bring a birth notification. And then what is the date to prove as date of birth, the name, the parents and all that. Then you know you need a NIN with the time as you grow in the education system. So that is now the second. The other one, in terms of health, this statistic informs data for health. To plan, how many children do we have? And therefore, how many vaccines should we plan for? How many commodities in terms of medicines and health supplies do we need to plan for? Where do we take health facilities? How do we upgrade them from health center 3 to 4, given the population in that area? How many health workers do we need to employ? And therefore, how much money do we need? So, data for health, these statistics here from CRVS informs planning and allocation of resources. But also, it helps government to know what things are affecting the population in terms of disease surveillance. We shall be able to tell that in this region, we are having this disease. You talked about Mpox. If our system of CRVS was fully functional, up to date, would be able to track who is so and so by just clicking in a NIN of someone, and you know where they have gone for treatment and who has worked on them, where they come from, their behavior. That is what other countries have reached.
I was going to say,
and that is why we
are doing it. We have a Zoom.
And that is why Uganda is trying to see that reach that level, such that when you go to get a passport, they are not again asking you to produce forms, go to the LOC, go to the RDC. The issue is, what is your NIN? The passport office should be able to get your data.
When they just put in that NIN.
When you go to the bank, they shouldn't be asking, do you have an ID? Is it expired or not? These are the things. Is it fingerprint or the NIN?
Exactly.
So the NIN is entry, the fingerprint is another way of biometrics. Now they are going to add the iris, just to be more definite. So in terms of health, we are saying that we need the statistics, and it all comes from birth registration. So when the health system has this data, and also the community, for children who are born in the community, a VHT, Village Health Team, and LOC should be able to notify the sub-county chief or the mayor in a municipality. They have a system to record this and notify NIRA that, you know, in our municipality, in our sub-county, these are the number of births this month, this quarter, and then NIRA does its job to assign a NIN, and then they wait for that child. As the child grows, with the time, they'll get an ID. I think at the age of 16, they're able to get an ID. But they have to go through a process where the parents go and apply for a birth certificate, which is legal proof that you're Ugandan. Having a birth notification is not legal proof that you're Ugandan. It's just a process to notify. That's what it's called, notification. Just notify. So that information is important, as I said, to plan and allocate resources in health.
How about the death itself?
Now, when it comes to death, on finance I had talked about it. Banking, you need it. People missed PDM, the parish development model. Just because they didn't have IDs, they missed it out. Others, even associations.
Many campaigns miss out.
Because of IDs. So Ugandans need to do that and get IDs. So even travel, people normally suffer. Others pay hefty fines because they don't have up-to-date identification documents. And so it is important that Ugandans do it early. Now, for today we are on birth registration and death registration. So for death, government would like to know how many people have died because of accidents, for example. This is a normal thing we see. You see, when someone dies, by law, there has to be a medical certificate for cause of death.
Autopsy.
So we normally have, in the health facilities, we have maternal, perinatal death reviews to account for the death of that person, despite the age and gender. That is on record. Now, that is not done with NIRA. Ministry of Health does it, and it has the records there. But that information is not accurately and timely shared with NIRA. Okay?
Yes.
Such that people are able to know. These have died because of accidents. These have died because of maybe overbleeding. These have died either because of diabetes.
Yeah,
These have died because of cancer.
Yeah.
That should be coming in such that when this information is shared for cause of death, the information is relayed to the Ministry of Health. It is analyzed, shared with the NIRA, and then UBOS, the statistics agency, lead agency for the country, is able to publish an annual report showing the status of civil regulation and vital statistics in the country, such that even banking communication uses the same information to say, hey, this person was having a loan, for example. The loan is not being paid. Is this person dead, or what could be the cause? But you see, death is not declared because the family perhaps is still getting money through the ATM.
Yes.
But this person is dead. And government is still paying salary
person.
for the ghost workers or civil servant. So I'm bringing back to you the importance of death registration.
I see even, in fact, we've heard of what they call the death rate, where, in fact, these days the government is trying to encourage people to get married. They're putting in incentives, please get married. Because from my perspective, I think after interpreting the data, they see where the problem is. And it's, I think, we're having a low birth rate. How do we improve this? Isn't that in the long run?
In the long run, those are some of the explanations that come up from different agencies. But we want this to be centralized when the system is speaking to each other. And so one of the importances or the benefits of having death registration is that people get to know, one, the cause of death for their loved one.
Exactly.
Government will also be able to account. That is one. Then two, the other benefits. Others are inheritance issues. Others are family issues. Others are for health. Government will be able to know what is leading to cause of death. Now, if it comes to accidents, a policy will be initiated to guide how best can we reduce death due to accidents.
I get you, sir.
If it is drowning, for example, in water bodies, a government will come up with regulations using that statistic and say, you thought there are few people who are dying, but even one person counts. Why do we have people die on water? Why do we have people die in the swimming pool, for example? What are the regulations therefore we are putting in place to guard citizens from death?
Wow. I get it. So these, generally the statistics help us to shape decision-making processes for individuals, government organizations, and everybody really. I know that
investment.
Yes. I know there are some challenges that you get, especially when you are getting such data in field. Can you take us through the process? How is it, and of course some of the challenges that you've been grappling with in that regard?
According to UBOS, in the previous census of 2024, it said, it reported that only 31.4 Ugandans have notified their birth. But of those, I think only 11 point something have birth certificates.
That's true. That's very true.
That leaves us with the 1 out of 10 people without birth certificate. Now, that is a big number. We appreciate all stakeholders have tried to do that, but there are challenges that are there that are causing this. Sustainable development goals have a target that by 2030, for example, there should be 100% birth registration. 2030, today is?
2025, 5 years. The SDGs.
The SDGs, I think SDG 17, it has some targets. it also goes ahead to stipulate that by 2030, we should have 80% of death registered. But in Uganda, I think it is less than 5%.
Yeah.
Death registration.
Yes, that is very true, by the way.
Is less than.
We only register when we need that certificate. In case there is maybe inheritance issues, there is bank you have to get. We rarely, yes, we rarely register
land
deaths.
issues.
We rarely register deaths,
yes.
sadly.
Yes. So, you see, there's a big gap.
Yes, I'm saying.
The same applies to birth registration. Now, there are many things in there, ranging from the law, others are financial, others institutional coordination, others are public information and awareness issues.
What's wrong with the law? Isn't the law clear enough?
The law has enabled registration of persons, but it has not been explained to the public to understand. For example, it will say that a person should be registered immediately after birth. So what is the definition of immediate?
Yeah. Yes.
Is it in 1 hour? Is it after 1 week? Or is it 1 month? What is immediate? But when you go to the NERA regulation, registration regulations, there is now a fine. When you register a person after, I think after between 7 months, let me just be clear for the record. When you register a person between 7 months and 6 years, there is a fine of 10,000. Yes, you're late. You're late. It's no longer immediate. And when you go between 7 years and 18 years, you have to pay 20,000. I'm showing you that. Now, the public does not know this information.
Exactly.
But it comes from the law. So, to define what immediate means should be very clear.
Tell us, the child should be registered between 7 to 14 days after birth.
Exactly.
Be exact.
Let it be such that, and state who does it, who should do it.
Yes.
Of course, the guidelines say in the facility, the in charge and all the medical officer should feel. You know, NERA has its birth notification registers at every facility from Health Center 3, because they do they have maternal and delivery services. So that should be clear. Even to them. And also it should be included in the key performance indicators that if you as a midwife does not report as part of your work the number of children or births you have notified government about, then you are not performing in this area, such that it is incumbent upon them to be interested and it becomes their responsibility to ensure that as a mother is in labor suit, the next step, as the kid dies, BCG is given, and after that, birth notification details are done. And so, I'm coming to the challenge.
Yes.
What the law is not doing. Now, at institutional level,
yes,
how are the public servants supposed to notify, inform the public, be doing? Our health workers, for example, they do a lot of work we appreciate, but now they need to integrate birth and death registration or notification, this matter, in day-to-day work. That in antenatal care clinics, they integrate birth notification. As you plan to come for delivery, please come with a photocopy of your ID and that of the father of the oncoming baby, such that it helps us to notify government about this death. Come with a probable name, all those details, such that by the time the mother leaves, everything is registered. If they miss, for some other reasons. Then during immunization process, because immunization goes on, after 1 year, this should be done. So information in the public is missing.
Yes.
Public awareness has a big gap.
Yes, I get you.
We did a Track FM public engagement. Track FM uses software to engage the public through other radio stations. And the statistics which came out showed that about 61% of the public don't have information about birth registration. Others hear about it, but what is the benefit of registering? What is the benefit? After all, we've been there, it rains and it shines and we have our food. Why should I bother anyway? That is one. The public has lack of clarity about these fees I'm talking about.
I did not know them, and I'm a
Yes.
journalist here.
Yes.
I did not know them.
Some of those fees they don't know. But also, the other one is the distance the public has to travel. In the investment case we have conducted with support from Global Health Advocacy Incubator, HEPS has been able to get shocking information that some people have to travel between 30 to 50 kilometers just to reach a district NIRA office for this service.
Wow.
Then when you go, they say, no, you need a letter from the LOC for ABCD.
And you've moved
And this,
10 kilometers.
and this is a mother who has a capital of 40,000 selling tomatoes in those markets in our village.
Yes.
And she has spent maybe 25,000. When do you think she'll go back?
She cannot. She won't.
I had to notify, I had
She
to look for
won't.
that.
Just to notify you, no, she won't.
And that's how some of them missed out on PDM. Because the long distance, they are not sure whether they will get what they want. So they're like, let me go on the way I normally live. So distance is a matter. But also there are districts which don't have registration offices.
NIRA officers.
Yes. They are now above 20.
Yeah.
The last time we had, there were 24. But also there are other urban authorities that have come up that don't have these offices. Now that one compounds the problem. Then human resource in NIRA, it is at staffing is at 50%.
Wow.
It is also a budgeting problem. When you go deeper, little funds are provided. Okay? Not only to NIRA, but even other MDAs that do registration or information collection from the public, like Ministry of Health also.
Yes, sir.
The health information system needs to have more allocation of money, such that some of this information is relayed to the health workers who are serving communities, such that they know it is urgent, not the work of NIRA. Because it is them who deliver the mothers, isn't it? And they have registers. So it is just an ethical issue to say, let me notify government that under my custody, I have a new Ugandan. And you submit. In fact, should be a NIRA registration officer to pick that data. So they also have issues of funds to ensure monthly or quarterly collection of this data to be input in the system. So I'm bringing on another challenge. There is lack of interoperability.
What is that?
This is where systems of MDAs have to collaborate or interlink. That for me, when I'm having information about birth and death, there is where I post it, and someone from the other the other agency can access it for use, analysis, dissemination, something like that.
Like what is done, for example, on passports and permits, that right now I don't need to speak my name and my everything. I just bring my NIRA number or my NIN number and I say, this is my NIN, give me a driving license.
Exactly.
Okay.
Exactly. In some countries, you will see if you are got, for example, for drunk driving by a traffic officer, just a mere tap on your database, they will know that is not the first time.
Yes.
you have committed that
offense.
That offense.
Yes.
They will even know where you come from. Some key information you should not get in public. Yes, but they have it, and this information is very private. One of the things the public is concerned about is will my privacy.
Yes.
But it is private. It is confidential information, and therefore it is highly guarded. Okay. Yes. So the public doesn't need to be worried of it.
About
yes.
that. Okay.
So the other challenge now we have, I've talked about interlinking agencies. We've talked about budgetary allocations. We've talked about issues to deal with the public information.
Yes.
The issue is stakeholder coordination. Some of these things are like a prerogative of people who can afford.
Yes.
Yet it is a right of every Ugandan to be registered and to be known. If a birth is not registered, then it means that such a Ugandan is not being recognized, which is not a good thing.
Okay.
Yes.
I don't know. Can these problems be addressed? Can we improve access in your thinking?
Why not? Why not?
How can we do this?
One of the things we are happy about as HEPS and GHI is that we have taken this out of the books, out of the websites, and tried to create public awareness. And so people have started to ask for the services. And so when you ask how can this be done, the first thing is to create awareness in the public. Let people appreciate that it is their right and it is mandatory, because where we are going,
yes, sir.
If health services need your name, how many people will miss out?
Many.
Many will need. If they say you are an adult, just bring your ID. How many will miss out? Many.
Yeah.
The elderly, who thought, they are still alive, and Ugandans who need to be known in the system. So public awareness creation is key, and it takes all stakeholders, not only NIRA. It is incumbent upon me to ensure my children are fully registered. I shouldn't be pointing at NIRA.
And we're waiting for NIRA to remind us.
No. It should be that I know this, and that when I do it, I'm satisfied that yes, my family members are registered. So it is very important for all stakeholders. We want local governments, district local governments, to take up this. Of course, we are aware that we have NIRA offices in more than 100 districts and urban centers. But somewhat when stakeholders are mobilized,
yes, sir.
Registration officers are not involved, because that is where they would now notify the stakeholders, technical team, the political team, the administrative team, that look, this is not happening.
Exactly.
How can we work on this to improve?
And they are vital because they actually
exactly. Because the planning and budgeting cycle of Uganda starts at parish level. PDM has a pillar for data, has a pillar for health. Now, this information is key to be integrated, even in the PDM programs that are going on, because it is the district local governments that are initiators of the planning and budgeting process. So if they don't know the people they are planning for, they get wrong plans.
Yes.
They don't know. Someone died and the system is still counting that someone exists.
Exactly.
Someone got born again, got born, but they are still,
don't know that
they think we are still few people,
hey.
Yet we are increasing. I'll give you an example. If you are in a family, there is holidays time when a family is full board.
Yes.
And there is a time when they are at school. Now, what brings that is when kids are at school, the budgets have to also be tuned accordingly, isn't it?
Yes.
And when they are back, every guardian and parent is saying, oh, I have full board. budgets are increasing.
Yeah.
Guys have to go to church, guys have to eat, guys have to do a BCD, my shoe got spoiled, those repairs and what.
Yes.
So, if a parent does so at home, how much more should government do for 45.9 million people?
Yes.
Yes.
Exactly.
So, the other strategy is increase funding. Increase funding to the CRVS agencies. Of course,
To the you.
yes, yes, increase funding.
Exactly.
So, of course, we appreciate that
People
336 billion was given to NIRA
Yeah.
to do the mass registration and renewal, which has been already organized.
So, yes, it's.
And I
it's
think
going
they
to
are
be
training
implemented.
registration officers to start doing
I
the
think
job
this
in
year.
April. Yeah.
To this month.
Yeah, this
exactly.
month they are starting. But after the campaign, so do you go back to the same?
The default settings.
And then we wait for another campaign which will take now maybe 400 plus billion, and it has taken a long process to have even that money
You
allocated.
remind me of the population census, how we disseminated money in November 2023 for a project that was going to start in 2024. And we always know that every after 10 years we do a population census.
Exactly.
I know what you're saying.
Yes. Yes. Now, how about if they had said this 366 billion is divided in every financial incrementally, that we are going to add 50 billion on the budget of NIRA to ensure that NIRA has a national office. By the way, NIRA's office is under Ministry of Defense and Veteran, and in Kololo.
Yes,
Yes, it is not
the
their
headquarters.
property. Yes,
Oh, okay.
they are just there for some time. Now, if that money is allocated, they can know we are going to construct a fully fledged national headquarter for NIRA, such that when there are other national events, work still goes on.
Okay.
We have district offices expanded, staff employed. We have budget for community outreaches, where district officials can't reach. There can be outreaches as well to reach far located communities for registration, but also train all people, retool people in health systems, reporting and registration, the health workers, the VHTs at community level, the VHTs and the LOCs need to be given this information such that it is part of their community mobilization.
Okay, because of time I'm going to stop you there, but lastly, what are some of the ongoing projects? What is happening at HEPS Uganda for today, but also for the future to come?
In terms of statistics, we have had work going on. I told you earlier to have community-led monitoring, which monitors access to HIV, TB services in the country. That is 1. 2, under this, we are working with health facilities and health ministry to see to it that this is integrated. The Permanent Secretary for Ministry of Health urged all stakeholders, particularly in the health ministry, to ensure that health services are integrated following the exit of USAID funding. You remember?
Yeah.
And so we are proposing that even on that, let birth and death registration be strengthened and integrated in the day-to-day work of the health workers at the facilities. Yes.
Okay.
Yeah.
Thank you so much, Mr. Ochit. It was a privilege having you this morning. Now it's time we take a break. You're still watching the Mighty Drive Show. My name is Edgar Mathew Karuhanga. When I come back, I'll be joined by Charles Onyum, who is the media coordinator at the Global Health Advocacy Incubator. Let's take a break. We'll be right back.
The Alternative Dig Talk. real issues, real talk.
Go to the church, though.
Tawali man, what's up?
Man, can you imagine people just dump everywhere? Someone drinks water and throws the bottle wherever.
Come on, Rogers. What else do you expect people to do with an empty bottle?
Simanya now, Recorder. Do you know that plastics take at least 450 years to decompose?
What? That's a long time.
Exactly. Because plastics are made out of a lightweight and flexible material that doesn't decompose easily. And plastics everywhere in the environment cause plastic pollution.
What is plastic pollution now?
It is the accumulation of plastic waste in the environment, like bottles, polythene bags, straws. All of these contribute to plastic pollution.
I have been using them without knowing their effect.
Yeah, a lot of people have. Plastics are a danger to the ecosystem, both on land and in water.
So how can we overcome this problem? Is there something we can do?
Oh yes, we can reduce by minimizing the use of plastics, reuse by repurposing them, or recycle by collecting and processing them into new products.
Everyone wants to change the world, but no one wants to change themselves for the world.
How about we change our habits for the world?
And it starts with me and you.
This message is brought to you by Alternative Digitalk.
Hi Rogers, can I ask you something?
Shoot.
What does corruption mean?
Well, summarily, corruption is abuse of public power for personal gain or for the benefit of a group to which one owes allegiance. For example, when a public office is abused by an official accepting or soliciting a bribe. By the way, private people can be corrupt too, like bribing police officers to escape fines.
Okay. So exactly how does that concern me?
Well, do you pay taxes?
I guess, yeah. What does that have to do with this?
Everything. Because those taxes you pay are supposed to facilitate services you use, like water, electricity, roads construction, medicines in hospitals, name it.
Okay, that is much bigger than I thought. But it can be stopped, right?
Well, yes it can, although it may not be as easy as it sounds. And here is the reason why. Corruption roots are grounded in our country's social, political, economic, bureaucratic traditions and policies.
So, what has kept it going this long? I mean, why don't we stop it?
Well, the main reason why it has been here for so long is because institutions are weak, either as a result of poorly defined ethical standards of public service, weak administrative and financial systems, or ineffective watchdog agencies.
What can we do to stop it?
At a national level, we must focus on strengthening the independence and effectiveness of public institutions that fight corruption. At a personal level, we must commit to never giving a bribe.
I promise I'll never give a bribe.
Well, that's a great decision you have made. Me and you now have to spread this message to all our friends. If we all do our part, corruption will be no more.
This message is brought to you by Alternative Digitalk.
The Alternative Dig Talk. Real issues, real talk.
Welcome back from that break. My name is Edgar Mathew Karuhanga and you're still watching Digitalk TV, and this is the Mighty Drive. Every Monday to Friday we're always here starting from 8 to 10 a.m. having a conversation with you and of course helping you make informed decisions from an informed perspective when you know what is happening in Uganda and across the globe. This morning, I'm joined by the media coordinator for the Global Health Advocacy Incubator. His name is Onyum Charles Okao, and of course, we are continuing with the conversation that we started earlier this morning of the civil registration and vital statistics in Uganda. You're most welcome, Onyum.
Thank you, Matthew, and thank you for Digitalk and you having to raise awareness on such a very important issue. Thank you so much. This is CRVS is usually only considered from the statistics point of view, but it's about identity. It's about access. It's about national development. So it's a very important issue, and thank you so much for Digitalk putting spotlight on the issue. Of course,
the pleasure is ours. We had we had earlier on Robert, who painted a picture of the importance really, and a light came on in my mind of how really you can't do anything, especially in planning, without having vital statistics. But before we even delve into that conversation, if someone is hearing about this incubator advocacy, Global Health Advocacy Incubator, what does that mean?
Global Health Advocacy Incubator is a global NGO that works in more than 43 countries around the world, and our primary focus is on helping, being a part and parcel of the health system strengthening. So work with civil society organizations and government to identify areas where there are gaps, maybe in a particular health system, and then collaboratively identify how we can come up with systems and strategies to mitigate the impact of the policy gaps, for instance. So then afterwards we work to provide technical assistance such that governments can develop organically these policies which are homegrown, apply to their respective situations, and can be sustainable, because if they have developed them, they are part of them. We've simply just come in to identify and through civil society raise awareness on some of these areas, then government actually takes up and creates policies and regulations which then provide a working environment to make health systems stronger.
Yeah, that's great. How do you bridge these policy gaps? Do you have themes? For example, are you looking at human rights? Are you looking at health? Do you have themes that you say, we base on this theme to advocate for policies that are in line with that vision? If, for example, you like, you are into health, do you advocate for policy around health alone? How do you, what are your themes, or what is your niche really?
Oh, thank you, Matthew. If I was to use a few words to identify the niche for GHAI, it is in incubation. This basically means that we identify an area where there's a great public health challenge. Take, for instance, we are in drowning prevention, where there's a number of Ugandans who are dying each year through an unknown issue, previously unknown or under-prioritized issue. We've been and still are in road safety, where still also a number of Ugandans are dying due to unintentional injury and death. So when it comes to data for health, this is an area where statistics play a very big part in governance. And then now we have a challenge, as Robert has mentioned earlier, that there's quite a bit of statistical gaps in either in challenges of collecting, tools for collection, and so on. But it all boils down to, do we have policy prioritization of the issues? Does government identify and know that these are areas where once we all collectively focus on, it can result in actual reduction of unintentional death and injury, or a reduction in deaths, for instance. So to answer your question, our niche area is in providing technical assistance to governments and CSOs, so that collaboratively we can have policies which can in turn save lives.
Well, thank you. You've been in operation for the last 10 years. Can you track impact to say, for the last 10 years, these are some of the fruits that we have as an incubator?
Okay. I'll start with here in Uganda. In the road safety space, Now, when we had highlighted that a number of Ugandans were dying annually due to issues around road crashes. Now, one of the things that came out was that police was having a challenge implementing the law. So there needed to have been adjustments and updates in the regulations surrounding management of road safety.
Yes.
Then when it came to budget provision for the Ministry of Works to manage the road safety initiatives, this was at the start around 600 million per year.
Yes, sir.
Now, once regulations were passed through the 2001 Road Safety Act and then regulations which followed, now what you have is that there's an increase in appreciation for road safety infrastructure around roads. So now when road constructions are being done, now you find that pavements for pedestrians are taken into account.
Yes.
Islands for pedestrians as they are crossing a busy road where they can stand in the middle as they wait to cross the other section are being integrated. So a human design element was put in place because the regulations took into account the human pedestrian element.
Wow.
So now once these policies were then put in place, then it came to other aspects of the road safety, because road crashes, for instance, even before even you talk about road crashes, many were saying road accidents, meaning that it was an act of God. Road accidents are not an act of God. It is because of human behavioral, attitudinal issues. You go drinking and expect to reach home driving drunk safely.
Yeah.
That's impossible. You will crash.
Exactly.
There's a higher possibility of you crashing when you're intoxicated. Judgment is reduced. So there's a component of behavioral adjustment, and this also included media advocacy.
Yeah.
So once the media were trained through CSOs, who GHI came up to provide technical assistance for media to understand what kind of issues they should be focusing on as far as road safety is concerned, then they started reporting on stories properly.
Okay.
And by properly, it feels subjective, but this means that journalists were no longer reporting issues of number of accidents or who died in an accident, but rather what was the cause of this crash.
Yeah.
And once these were starting to happen, then it wasn't just a matter of because a prominent person dies in a car crash, then you have a media story. It was now even the previously unknown Ugandans who were dying on the roads who were still being published. The number of children who were dying on their roads needlessly near their school because of no speed limits. So speed limits was now integrated through the road safety regulations, which are now come up. So now issues of seatbelt use, helmets, and several other initiatives, which were because policy was put in place and regulations to implement them, now police were able to come up and then systematically implement and act on them.
Wow.
Now you have systems being put in place without external funding being added, because government has appreciated the priority need.
Yeah.
And when priority is appreciated and how important it is to escalate its importance, then you've got budgetary spend.
Yeah.
Now this came from raising the budget from 600 million annually for road safety initiatives to 5 billion, just over 5 billion. And currently in this financial year, 9 billion was attached to road safety initiatives. So this is where GHI comes in, and that is in Uganda. In other countries, like for instance in Vietnam, there was a very large challenge of drowning, and the country like Uganda is Vietnam and Bangladesh. These are countries which have very many water bodies, suffer consistently flooding due to either climate or other factors, but mostly because they have water bodies in country, just like Uganda. And as a result, you have many deaths happening, and there was not enough prioritization put in place. Like, for instance, it's little, when women go out to work, as the primary caregiver, women tend to have children on top of their work. So what happens if you're in a waterborne area and you leave children in the house unattended to, and you go off because you need to feed them? Then what would happen is that either when they're going from home to school, along the way they could drown, or they drown at home, either in buckets, in the unattended water manholes or pits, which have now been filled up with water, and then you have drowning take place.
Yes.
Now the woman takes the shame. So now if you don't have policy which comes up and say, as a community, let's take constructive responsibility and provide health care or child care centers to help make sure that these women have a cushion. These are initiatives which have been implemented in Vietnam and Bangladesh through raising awareness, and that is where we come in.
I can see, it shows me how the small acts that you're doing can actually propagate a bigger vision, because I see it from a perspective of you're doing something here, but in the long run, the effects are recurring to the time when policies actually changed. Someone will not definitively pick on the action, but it's like how they say the flapping of a butterfly can cause in Uganda can cause a tornado in the USA. I can see how you're doing work. I'm still with Charles Onyum Okao, who is the media coordinator at the Global Health Advocacy Incubator program. So how do you come through the civil registration and vital statistics in Uganda project with HEPS Uganda? How do you come about? How do you enter this particular issue?
Okay. Like I've mentioned before, our model is to work with government and CSOs. Now, HEPS is an organization that is working in different programs, but one of the key area programs that they're working with and how we come in is in the data for health.
Okay.
Now, in the Data for Health initiative, they're working to raise awareness on the values of CRVS, as Robert has aptly shared, but also at the same time through initiatives such as the investment case and raising awareness on where there are systemic challenges. Then one of the solutions to some of these challenges would be in policy enhancement. So you find that there is an existing policy on ensuring that Ugandans are registered continuously, timely, and mandated. However, due to one issue or the other, which are usually policy-based or budgeting or resource issues, then you find that there needs to be some strengthening somewhere. Now, GHI comes in to provide technical assistance on how the CSO can interact with different stakeholders to raise awareness at different stakeholder levels, such that the issue is properly understood as a foundation for major government decisions. So this is how we now come in. And then where there's a question on how can we do this? How can we identify the gaps? How can we start the process sustainably? Then GHI comes to provide the technical assistance to guide on leveraging on our experience working in different countries. Then we can showcase how this has been done in other countries, but more importantly, how we can fashion this to work for Uganda.
Okay, for the case of HEPS, what kind of technical support did you offer them? If you were to say, did you advise, were you soliciting for, I don't know, what were you exactly, what kind of technical support were you offering?
Okay. Now, to begin with, we don't come in with a problem which is not existing. So HEPS identified that they're currently trying to increase on data, on the data use for decision making. Now, one of the challenges they initially faced was on how can we make sure that the right stakeholders are involved as early in the process as possible, and then do what we call a legal review. Because at the end of the day, it all boils down to what is the law. So the law mandated continuous registration and mandated it for every Ugandan. And this is also enshrined in Uganda's aspirations as a signatory to the SDGs to make sure that by 2030 all Ugandans are registered. However, there are some gaps.
Yes.
Now, we came in to support the legal review to identify areas where there were gaps in the legal system, where either some aspects weren't clear or needed to be put categorically clear, and then that's where we came in. Then two, there wasn't, I would say, proper appreciation of the issues, and rather the focus, especially in the media, was on the political aspects of the national IDs. Now, national IDs are only one aspect of the civil registration and vital statistics process. However, in Uganda, when we came in, the focus was largely on national IDs this, national IDs that, and so on. So now we came in to provide the technical assistance in supporting journalists understand the essential issues around CRVS, so that they appreciate that it's not about politicking national IDs, but rather appreciating that that is only one part of the puzzle.
Yes, yes, I get you.
And then also now providing support in how to work with different stakeholders such that you have complete buy-in, because key to every GHI approach is sustainability. If you don't have sustainability, then if we pulled out, there would be collapse. So we transfer knowledge
of how you can actually
of how to sustain it, how to begin it, such that the CSO continues even after we've pulled out.
So do you, I saw the word incubator, and do you work with young innovators or CSOs that are just starting off? What is the criteria? But also, before we even look at the finances, how has it been working with Ugandan CSOs and innovators in this country? How has the process been for you?
Okay. You see, when it comes to incubate and the term incubator, it is quite common to associate it with entrepreneurship and the innovation space. What seems to not come out clearly is that being able to be able to be a do-it-yourselfer is only one aspect of the incubation. There is also the thought process, knowledge management, and knowledge transfer process. Now, when it comes to GHI, it's about the knowledge transfer, the technical human resource aspects of it. So our product is largely intangible, but it has tangible results when done well.
Okay.
So when you ask, we're working with youth, young enterprises and the like, yes and no.
Okay.
Yes, in the sense that we work with the CSOs, some of which may be budding enterprises. We look for the passion in them and the will and the desire for them to actually have lasting change which benefits humanity. Now, at the heart of it, when you look at the CRVS space, for instance, and then you see that out of the 45 million Ugandans, currently about 9.8% have managed to get registration before 1 year. And then an additional 10.3% managed to get registrations for their birth certificates below 5 years, which according to the census gives about 11.4% of Ugandans who have birth certificates. Now, when you come now to the incubation aspect of it, how many organizations appreciate statistics? Math is not everyone's favorite. And as soon as you start mentioning math the way I have just done, we start to lose people. So this basically means that if we get an organization to appreciate that the data is what governs decision making, it's at the heart of the governance process, then that is one part of the step towards coming up with sustainable solutions. Then once they start to understand that data is at the heart of even today's world, if you, I remember you spoke about GDP and so on. Now, how can you know about GDP if you don't have data?
Exactly.
How can you know about the number of Ugandans who are disproportionately affected by accessibility issues if you don't have data? So at the heart of it is empowering civil society organizations and government to appreciate the values of this data. Where we come in is to build capacity to appreciate where focus needs to be taken into account, and to build capacity to appreciate which priorities need to be aligned with government developmental agenda. So that at the heart of it, when you have political misdirection, then we strengthen CSOs to see past the misdirection. That is where we come in.
To see past the politics, and Uganda has a lot of politics. We politicize literally everything.
Not Uganda alone.
Yeah, but there's how Uganda is actually really different, and because everything, we are skeptic about everything. Let me come to the financing. Do you finance these people directly? Do you give them financial support? Even also, how do you secure funding as an organization that has aided your impact and work?
Okay, thank you. Now, as mentioned before, at the heart of our work is sustainability. And from the recent pullout of one of Uganda's biggest funders, we have seen what happens when you rely heavily on funding.
Exactly.
Donor funding is not a sustainable model. Now, ours is that Uganda is, for lack of a better word, wealthy. We are not called the Pearl of Africa for a bad reason. We've got a wealth of knowledge, a wealth of human resource, a wealth of different resources, and government collects quite a good amount of money annually. The challenge is that at different steps of the decision-making tree, you have different interests and different levels of prioritization of issues. So when it comes to GHI work, we do not provide funding per se. Now, you can be given, say, 1 billion shillings to achieve some project outcomes, but if sustainability is not at the heart of it, you may finish it and need an additional 1 billion shillings. Now, instead, if you're shown how to make sure that you use this 1 billion, which you already have, but you wanted an additional 1 billion, productively in areas which will matter to you. And then that's how we come in. So Uganda has financing. Like I gave the example of what has happened in road safety. Initially, Uganda was apportioning 600 million.
Yes.
But today, in this financial year, it's over 9 billion.
9 billion, yeah.
This is not donor funding. This is provided for by government of Uganda.
Yes.
So did GHI give it? No. Government of Uganda provided that funding. So what's important and comes strongly is that when it comes to the policy makers, the general public, and you, the media, there's very many health system issues which are around, such as the case of the CRVS issues that Robert raised. However, to get them to be mitigated, there is need to prioritize under-resourced agencies so that they can be able to do their work better. How can this happen? If you have challenges in the legislation, you don't have a legal provision, legal mandate. For instance, like how should NERA carry out registration of a birth, for example, from beginning to end? There are issues of consideration like accessibility of that service at the heart of the matter. If you have we have 149 districts in Uganda, but only 114 of operational offices for NERA, meaning that there's a number of offices still missing countrywide. But even when you have, and currently NERA is has sought financing to support an additional 24, so that gap can be reduced. But now, even when these offices are located in the different districts, you find that they are located at the district headquarters or near the district headquarters.
Exactly, yeah.
What happens to people at the farthest end of that district?
They have to come.
On average, it means that they may move more than 70 to 100 kilometers to access the service.
Yeah, that's a long distance, really.
A very long distance. So now, where we come in is that can the policymakers prioritize this higher up in the agenda? Because like when we talk about underfunding in health, then what is the basis for the underfunding? It's because we don't know how many Ugandans are in a specific area.
Yeah.
We may know we have 45 million Ugandans, but do we know how many Ugandans are living in one specific area? So that not in Kampala, countrywide.
Okay, yeah, I'm giving an example of a designation.
And giving the example of Kampala, for instance, we talk about up to 5 or 5+ million in Kampala by day.
Yes.
By night, where do these live? So if we do not have real-time data about where Ugandans are staying,
so are you saying from the lowest
point,
village, parish, you want to know all those numbers?
No, we don't necessarily need to know all those numbers as GHI, but as government, government needs to know how many are living where, especially how many are born where, which area, which district, which village, and how many have died where, so that you can easily have a real-time moving database. Then you can now plan. Because if you do not know how many Ugandans have been born in a specific area and are living there, then how can you apportion resources for that hospital?
Yeah, I get
How can you give enough drugs which will cater for the needs in that area?
For me, I will bring in PDM. How will, because you are saying 100 million per parish, if a parish has 3 million people, another one has 4,000 people, and all of them are receiving 100 million, can that be practical according to government? So, but let's continue. That was just my analysis.
So, once we appreciate that, then it starts to paint a clearer picture of the needs and the gaps.
Okay. What is the roadmap? In fact, you've not hinted on where you secure funding from as the incubator. Just a minute.
Yes. Now, when it comes to financing, Now, GHAI with its model is only providing technical assistance, so it is not giving money.
Yes.
So now by providing the technical assistance, then we cannot say that we are getting money and giving money. However, to answer your question more directly, GHAI from its inception first initially started as an organization which was raising awareness into the effects of tobacco, especially amongst youth and children.
Yes, sir.
So that is where the organization began from, through funding from Bloomberg Philanthropies, which is world renowned for supporting health initiatives. And hence that is why we have a very strong health system strengthening focus. So where we get the financing from is through our different partners, but primarily through Bloomberg Philanthropies to run that aspect.
Thank you so much. Coming to the end of this conversation, I am with Charles Onyum, who is the media coordinator at the Global Health Advocacy Incubator. As we conclude, what are some of the future plans? How are you doing it here in Uganda? What are some of the projects globally? But also some of the things that you feel you also want to hit about.
Okay. When it comes to plans globally, we have to take it into Uganda's context. Uganda is a signatory to the UN and as such has been working towards the SDGs attainment by 2030. We have about 5 years left. However, many areas, including civil registration and vital statistics, remain challenged due to one reason or another, but persistently it is largely because of the systemic issues. Now, the roadmap would be in the direction of appreciating that if we have the 11.4% who are duly registered as having birth certificates, let's start small. Let's try and work on making sure that registration by birth happens continuously, such that we can even have social protection for vulnerable groups. As a child who is not registered, it means it's as good as remaining invisible to the government. The government cannot provide social welfare for this child. The government cannot plan for education services. And this child cannot even be protected from early marriage. Because how can you know the child is underage if you don't know when the child was born?
Exactly.
So when it comes to the roadmap, let's try and see, can we have accessibility of these services, especially in areas which, for lack of a better word, as most people always say, in rural areas, and they don't have this access. So it would be looking at, can we encourage, one, the viewers to do their, initially to register such that they can have the birth certificates, but without placing the burden on the viewers. Let us have the viewers come to their political leaders and now start asking the questions that matter. Do you have access to these CRVS offices or services, and how can you access them? And why isn't your political leader discussing some of these issues? And at the end of the day, can we demand for prioritization such that when it comes to CRVS at the national level, we have proper discussions? Because if we are not discussing it, then we cannot be finding solutions to some of the systemic issues that surround it.
Thank you so much, Mr. Onyum. Just your parting shot, and we'll call it a morning.
I believe that it is just the beginning. Let's keep the conversation going.
Yes, sir.
11.4% of the population who have birth certificates is too low. Let us continue to make sure that this discussion continues on. We demand a strong effort towards prioritization of this very important decision-making aspect of government, and then we make sure that every Ugandan deserves to be counted.
Okay.
Thank you.
Thank you, Mr. Charles Onyum, and thank you to our viewer who has been watching us from the time we started up to this moment. There's a lot of knowledge and things that have been shared this morning. I hope you get to start to implement some of the recommendations that have been made by the panelists I've had this morning. We've been talking about the vital statistics in this country, and of course we are interpreting them and trying to paint a picture why this is important. And my key takeaway is that we need birth certificates. Please stop getting the birth certificates at 17, 18, 20. Some are even getting them at 30. No, it's always good if you do what they told you. Register your child as soon as possible. Register a death as soon as possible, because this will help you. Do not just do things from a reactionary point of view. My name is Edgar Mathew Karuhanga. We shall see you again tomorrow at exactly 8 a.m. We'll be here having a conversation with Uganda. It will be a Wednesday. And of course, happy new month to everybody who's tuning in. It's a brand new month. We are into the month of April. Today is the first day of April 2025. Enjoy your new month. And from the entire team, God bless you and good morning, Uganda.
The Alternative Dig Talk. Real issues, real talk.